Candidiasis, or thrush is a fungal infection, mycosis, of any of the Candida species, all yeasts, of which Candida albicans is the most common. Also commonly referred to as a yeast infection, candidiasis is also technically known as candidiasis, menyliasis, and abiomycosis. Candidiasis symptoms. Most candidal infections are treatable and result in minimal complications such as redness, itching and discomfort, though complication may be severe or fatal if left untreated in certain populations. In immunocompetent persons, candidiasis is usually a very localized infection of the skin or mucosal membranes, including the oral cavity, thrush, the pharynx or esophagus, the gastrointestinal tract, the urinary bladder, or the genitalia, vagina, penis. Candidiasis is a very common cause of vaginal irritation, or vaginitis, and can also occur on the male genitals. In immunocompromised patients, Candida infections can affect the esophagus with the potential of becoming systemic, causing a much more serious condition, a fungemia called candidemia. Thrush is commonly seen in infants. It is not considered abnormal in infants unless it lasts longer than a couple of weeks. Children, mostly between the ages of 3 and 9 years of age, can be affected by chronic mouth yeast infections, normally seen around the mouth as white patches. However, this is not a common condition. Symptoms of candidiasis may vary depending on the area affected. Infection of the vagina or vulva may cause severe itching, burning, soreness, irritation, and a whitish or whitish-gray cottage cheese-like discharge, often with a curd-like appearance. These symptoms are also present in the more common bacterial vaginosis. In a 2002 study published in the Journal of Obstetrics and Gynecology, only 33% of women who were self-treating for a yeast infection actually had a yeast infection, while most had either bacterial vaginosis or a mixed-type infection. Symptoms of infection of the male genitalia include red patchy sores near the head of the penis or on the foreskin, severe itching, or a burning sensation. Candidiasis of the penis can also have a white discharge, although uncommon. Candidiasis treatment. In clinical settings, candidiasis is commonly treated with antimycotics. The antifungal drugs commonly used to treat candidiasis are topical cletrimazole, topical nystatin, fluconazole, and topical ketoconazole. For example, a one-time dose of fluconazole, 150 mg tablet taken orally, has been reported as being 90% effective in treating a vaginal yeast infection. This dose is only effective for vaginal yeast infections, and other types of yeast infections may require different dosing. In severe infections, amphotericin B, caspotungin, or voriconazole may be used. Local treatment may include vaginal suppositories or medicated douches. Gentian violet can be used for breastfeeding thrush, but when used in large quantities it can cause mouth and throat ulcerations in nursing babies, and has been linked to mouth cancer in humans, and to cancer in the digestive tract of other animals. Chlorhexidine gluconate, oral rinse is not recommended to treat candidiasis, but is effective as prophylaxis. Chlorine dioxide rinse was found to have similar in vitro effectiveness against Candida. C. albicans can develop resistance to antimycotic drugs. Recurring infections may be treatable with other antifungal drugs, but resistance to these alternative agents may also develop. Candidiasis is a common disease, yet every individual needs unique treatment and care. We encourage people with candidiasis and their families to learn, as much as possible, about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about candidiasis and how to treat candidiasis, just click on the link at description or visit www.mainmd.com. Thank you.